Hi. Um, Here I present my final project on the topic reducing type 2 diabetes risks in San Angelo through a community-based lifestyle intervention program. I'll give an introduction about diabetes in the US and in Texas and in San Angelo. So from research, it shows that about 30 plus million US adults have type 2 diabetes. 80 million have pre-diabetes, and one in every adult is expected to have type 2 diabetes by 2050. We know that type 2 diabetes is a growing epidemic in the US. This is a presentation focusing on preventive intervention targeting San Angelo population. So, uh, what is the health problem and justification? Here, um, type 2 diabetes is in high prevalence here in San Angelo, and the risk factors are poor diet, sedentary lifestyle, limited preventive care. And according to the US Healthy People 2030, focus is on modifiable risks, that is by the CDC 2020. So we know that in San Angelo, socioeconomic and lifestyle factors increase the risks of type 2 diabetes. And this is evidence support community-based effort to delay or prevent this disease onset. So what's the program goal? The program goal is to raise type 2 diabetes awareness, promote healthy eating, increase physical activity, routine screening and coaching, sustain long-term behavioral change. When we do all this intervention, they are structured all around measurable, attainable goals supported by research. So, the desired outcome from this paper would be to improve knowledge of type 2 diabetes, and healthier eating habits will increase in the community. People will engage in more physical activity, and there will be clinical improvement in H1C, blood sugar control, and weight. There will be greater community engagement. So each goal leads to concrete outcomes. Tracking them helps demonstrate the program's effectiveness. So what's the program structure? We have directors who oversee the entire program. We have dietitians who are nutritionists, guidance, lifestyle coaches involved in physical activity and behavior change. We have community health workers who go to the communities. We have administrative staff who give operational support. So this multidisciplinary team is essential for efficient delivery and coordination of services. So as far as stakeholders concerned, we have internal and external stakeholders. So the internal stakeholders are the program staff, participants and families, primary care clinics. There are a lot of primary care clinics here in San Angelo. So the stakeholders provide ongoing feedback and are directly involved in the program implementation and the impact. Regarding the external shareholders, stakeholders, beg your pardon, we have public health departments, schools and nonprofit organizations, faith-based groups, churches, local media, government health agencies, and NGOs. So, external partners amplify outreach and provide resources and help in building the program credibility. So what is the strategy that we implement in this program? We host events in local venues. We use radio, social media, print ads, and partner with clinics and employers. And we tailor messaging to culture. So The outreach must reflect local culture and values of effectively engaging the community. So the program metrics we use are there's enrollment and retention, diet and activity log, clinical indicators. We monitor blood sugar every 3 months, blood pressure and weight measurement, knowledge assessment, number of partners engaged. So these metrics provide a comprehensive view of the program performance. So we implement the CDC evaluation framework, which engages stakeholders, describe the program, and focus evaluation design, gather credible evidence, justify the conclusions, and ensure use and share lessons. So the 6 steps will guide the evaluation and ensure alignment with national best practices. So what are the evaluations? Step one, we involve community health workers, local clinics, and leaders. We document the program input and logic, model, and goals. When we see that stakeholder involvement ensure relevance, while detailed descriptions clarify goals and methods. In step three, we define evaluation questions. We use surveys, interviews, and clinical data. By so doing, we will evaluate both behavioral and clinical outcomes using mixed methods. In step 5 and 6, we align data with goals and outcomes, report results, and use findings for improvement. By so doing, results will inform future program modifications and will be shared with all partners. So this is a representation of the schematic diagram of the CDC program evaluation framework. It has 6 steps indicators. We have the engage stakeholders, describe the program, focus evaluation, design, gather credible evidence, justify conclusions, and ensure use and share lessons learned. So this diagram visually summarizes the 6 steps of CDC evaluation model we are following. In conclusion, um, community-based interventions involved, it has to do with them, um, San Angelo's programs align with national guidelines, right? And it engages stakeholders for long-term impact. Through this structured, inclusive, and evidence-based approach, we can meaningfully reduce type 2 diabetes risks in San Angelo and replicate this model elsewhere. Thank you.